Good morning, everyone. Thank you very much for joining us here today. My name is Chris Murphy. I have the honor of representing Connecticut in the United States Senate. I'm joined here today, most importantly, by some really fantastic advocates, healthcare consumers who are going to talk to you about the stakes right now when it comes to the Trump administration's assault on the American healthcare system and his desire to take away health care from millions of Americans who badly need it. But I am also glad to be joined here today by Senator Jones and Senator Casey, who will speak to you as well about the important work that this building needs to do, especially this month, Medicaid Awareness Month, in order to protect the gains that we've made under the Affordable Health Care Act and protect health care for the people that are with us today. The Trump administration's assault on the American healthcare system has reached new unprecedented levels. For a long time, Republicans tried to claim that they wanted to do away with the Affordable Care Act and replace it with something else. Well, they no longer even attempt to perpetuate that ruse on the American public. Tomorrow, lawyers will file briefs in a lawsuit that the Trump administration has joined to try to end the Affordable Care Act overnight. The result of this lawsuit succeeding would be a national humanitarian catastrophe. It would mean tens of millions of Americans, many of them in incredibly dire healthcare straits today, losing access to healthcare or seeing their rates increased to the point of unaffordability. The Trump administration has gone to court to try to invalidate the entirety of the Affordable Care Act immediately. This is a change in their position. Originally, they went to court to invalidate only the protections for people with pre-existing conditions, which of course was the one part of the law that President Trump said that he supported. Now, they are attempting to go to court to invalidate the entire act, lock, stock, and barrel. The protections for people with pre-existing conditions, the expansion of Medicaid to cover millions of vulnerable low-income Americans, the ability of parents to keep their kids on their insurance plan until 26, the insurance protections that stop insurers from limiting the amount of coverage they give you on an annual or a lifetime basis. It would all be gone if this lawsuit is successful. And tomorrow will be a very important day when lawyers have to show their cards as to their final arguments to try to strip away these protections. But we are also here to talk about the importance of the Medicaid program. And I'll allow Senator Casey, who's been such a great champion of the Medicaid program, along with Senator Jones, to say more about it. But without Medicaid, our emergency rooms would be overrun. Without Medicaid, we would have people dying all across America who couldn't afford insurance without it. Medicaid is one of the most important and most popular health programs in America today. Americans want Medicaid expansion to continue, and they don't support this administration continuing to use the court system to get done what Congress would not do. Remember, Congress decided against repealing the Medicaid expansion. Congress decided to stand up to protect the Medicaid program for millions of seniors and vulnerable kids and the disabled. Now the Trump administration is trying to use the court system, including the court right across the street, to try to strip away Medicaid from millions of Americans who so badly need it. So we're going to continue to press this case. We're going to continue to urge our colleagues to stand up to the administration to stop this sabotage of America's healthcare system. But we're also going to really promote the fact that, while we can make the case here in Congress, it has to be these brave advocates who are with us today, the little lobbyists, the parents of those who would have their finances at risk if their health care disappeared, and we're really excited to be here with them. So with that, let me introduce somebody who's just been a great champion for lowering the cost of health care, for making more sense of a system that continues to make very little sense for the people of this country, Senator Doug Jones.
Thank you, Senator Murphy. I really appreciate being here with Senator Murphy, Senator Casey, but more importantly, the little lobbyist. And Robert, thank you so much for being here, because that's really who we are here for. The folks that can come up here. There's a few of our little lobbyists that can make it up here, but there's so many around this country who cannot. If they could, we would fill Washington, D.C. with people who are advocating for the expansion of Medicaid, who are advocating for health care for all Americans. And I really appreciate the fact that they're here today. I want to talk specifically about Medicaid, though, because in states like mine, in Alabama, Medicaid serves as a real lifeline to so many folks, especially in the rural communities of Alabama, and so much of Alabama is rural communities. 1 in 4 Alabamians receive health care coverage through Medicaid. We could even expand that more if Alabama would expand Medicaid, which they have refused to do over the years. Another 1/5 of rural Alabamians could get health care if we could expand Medicaid. That doesn't mean that simply because they do not have Medicaid coverage that they don't seek health care. We all have to seek health care. And so what happens in these rural communities is that so many people will go in and seek that health care, and those hospitals and the providers simply do it for free. They don't get any reimbursement, they don't get any coverage, because they care about their communities and they care about the people in their communities, and so they provide those services. And that's why so many of our hospitals are facing significant financial hurdles. In Alabama, it's estimated that 88% of our hospitals are operating in the red. That's in part because of the Medicare wage index, which hopefully is going to be fixed a little bit for Alabama, but also because we have not expanded Medicaid, and we have lost some $14 billion of our own taxpayer dollars in Alabama. 13 hospitals have closed in Alabama since 2011. That's putting a burden on the hospitals that are open. It's putting a burden on people that have to drive an extraordinary length of time to get their health care coverage. So the time is long since passed for those states like Alabama that have not expanded Medicaid, and I think there's like 14 states, to go ahead and do so. We are now seeing an unprecedented attacks on the healthcare system in the United States by this administration. Unprecedented attacks on healthcare. We need to be working to expand healthcare. We need to be working to lower the cost of all healthcare, lower the cost of prescription drugs. But most importantly, let's give people what they deserve. Let's make sure that those who need the healthcare coverage through Medicaid can get it. And that's why I'm here today, to stand with these folks, to stand with Robert, to stand with Chris and my colleagues, and Bob and my colleagues, to try to make sure that we get this lifeline continued for all Americans who so desperately need it. We can do this, but it's going to take this Congress to stand up and speak out. And it's going to be up to us, because I can't go. I started to just give this young man my pen and let him go on the floor of the United States Senate so he could advocate for himself. It's our job to try to do that, and to talk to our colleagues, and to make sure that everyone understands this shouldn't be a political issue. It has become one, but it shouldn't be a political issue. This should be a bipartisan issue for all Americans, and that's why I'm proud to be here today. We need to stop the partisan attacks on people's health care and focus on the way that we can improve their lives, that we can grow our economy and strengthen our families and our communities. So thank you very much for being here today. I'm honored to be here. And with that, I'm going to turn it over to my friend and colleague, Senator Casey from Pennsylvania.
I want to thank Senator Doug Jones and Senator Chris Murphy for being here, and of course for the families represented here and the advocates. I want to say first and foremost that I think we learned a lot about who we are as Americans, not only when we passed the Affordable Care Act, but when we defended it. It tells us who we are as a people. Medicaid itself, which is obviously a big part of this debate, tells us who we are. We found out in 2017, and since then, that Medicaid is an us program, not a them program. A lot of politicians tried to convince people in Washington and around the country that Medicaid was about some other person over there and not about you and your family. We found out that Medicaid was an us program, because Medicaid is about our kids, it's about our seniors, and it's about people with disabilities. Just consider the numbers. When you consider just one state, I want to quote from a report, a summary of a report that was issued today, or issued recently by Protect Our Care, because they've kept a lot of good data. I'll just cite two numbers that relate to the people of Pennsylvania. Here's one headline on who Medicaid covers. Medicaid covers 63% of Pennsylvania seniors in nursing homes. 63% just in one state. That number is similar in virtually every other state. So almost 2/3 of people in nursing homes can't get there, and their families can't pay for it unless they have Medicaid. Unless you have about 89 or 90,000 bucks lying around per year, you can't afford nursing home care without Medicaid. Second, Medicaid is especially important to people in rural areas. 22% of Pennsylvanians living in rural areas are insured through Medicaid. That means 22% of more than 3 million Pennsylvanians who live in rural areas. 48 of our 67 counties are rural. Here is maybe the most important number in this section. The uninsured rate in rural parts of Pennsylvania dropped by 32% once we decided to expand Medicaid. So when we say Medicaid is about our families, when Medicaid is about us, we mean our kids, our seniors, and people with disabilities. We know that 45% of school districts rely upon Medicaid for medical and therapy services for kids that get special education. We know that almost half of the births in the United States of America are paid for by what? Medicaid. So when Republicans say they care about families, when Republicans say they care about seniors, let's put them to the test. Do you support Medicaid or not? This isn't a multiple choice question. There's only two answers here. A or B, yes or no. You either support Medicaid or you don't. Now, the administration gave us another reminder about Medicaid recently. The administration said that in their budget that they wanted to cut Medicaid by $1.5 trillion. I remember when they gave a tax cut to big corporations, to multinational corporations, which added up to about the same number, $1.5 trillion. So Republicans have a couple of questions to answer for the American people. If you're a Republican politician in Washington and you say you want to protect pre-existing conditions, which all of them have said over and over again, then they have to prove a couple of things. You got to vote against the $1.5 trillion in cuts to Medicaid, or you don't really support the Medicaid program. If you really care about protecting people with pre-existing conditions, in addition to other protections, then you have to march into a court of law and say that you support the Affordable Care Act and you're against. You have to be against the position taken by the administration. And if you're not against their position in the lawsuit, then you're not for protecting people with pre-existing conditions. If you're not against the Trump budget cut of $1.5 trillion cuts to Medicaid and $845 billion to Medicare, then you support those cuts. You either have to be for this pro-health care position or against it. And finally, the third thing you got to do as a Republican, in addition to opposing the lawsuit and opposing the budget cuts, the third thing you got to do is be against the Trump sabotage of our health care system. Over and over again, sabotaging the system by cutting back on advertising so fewer people enroll, cutting back on efforts to promote Medicaid and the Affordable Care Act. So if you're a Republican politician in the Senate and the House and you don't oppose the cuts, you don't oppose the lawsuit, and you don't oppose sabotage, don't tell us that you support Medicaid. Don't tell us that you support our kids, our seniors, and our friends with disabilities. Don't tell us that because you don't mean it. You got to prove it if you're a Republican. These families who are here today will hold all of us accountable in both parties. We got to make sure that we defend and protect Medicaid and the Affordable Care Act. And I want to thank those who were here with us today, and I have a special introduction. I want to introduce Brad Woodhouse. Brad is the Executive Director of Protect Our Care, who gave us some of those numbers and provide great advocacy. Brad?
Thank you, Senator Casey.
Thank you.
Thank you. Thank you, Senator Jones, for being here. I know you have to run. Thank you, Senator Murphy, for organizing this press conference. I want to thank the little lobbyists, the folks that we're going to hear from who depend so much on Medicaid and depend so much on health care that's been strengthened through the Affordable Care Act. Senator Murphy mentioned this month, April, is Medicaid Awareness Month, and all across the country, advocates and families and communities have been reflecting on the importance of Medicaid and the importance of strengthening Medicaid and what the Affordable Care Act did to strengthen Medicaid through expanding it. 36 states in the District of Columbia and many other states, Alabama included, are looking at expanding Medicaid to bring more people into the healthcare system, provide affordable care. I want you to think about that. 36 states in the District of Columbia, and states that are led by Republicans had ballot measures passed this last year. And the president is in court right now to tell all those people, all those state legislatures, all those people that went out for these ballot measures, he's going to tell them, I'm going to take this away because I'm in court to, as he said, quote unquote, terminate the law. To terminate the law. So take Medicaid expansion away. Go into court and do that and take away the rest of the Affordable Care Act. That's one way there's a war on Medicaid. As you heard from Senator Casey, a cut of $1.5 trillion to Medicaid. Now, what do you think that's for? That's to continue to fund a tax cut that this president passed that also raided health care in this country. So $1.5 trillion cut to Medicaid. His budget also proposed returning to repeal in the form of Graham Cassidy, which they tried to pull here back in 2017. A bill that would have, quote unquote, block granted Medicaid. Now, we know what that means in Republican parlance. That means cutting Medicaid. That means throwing people off the rolls. That means sacrificing the disabled and kids and families. That's what that means. And beyond all that, they continue to put requirements and rules into Medicaid that is nothing more than discouraging people from signing up, that are paperwork requirements that drive down the rolls. I mean, the person that runs Medicare and Medicaid for this president is running a war on his behalf against Medicaid, a program she's supposed to be showing support for. So that's what this month has been about. It's not just about celebrating how important this program is, but warning every one of you and every American that this is still remains in the crosshairs. Speaking of the crosshairs, the president went before the NRA last week, where he reiterated that he's coming for this entire law, which would include gutting Medicaid expansion. And I just wonder, has this president spent 1 second out of 1 minute, out of 1 hour, out of 1 day, out of 1 month, out of 1 year, thinking about these people, thinking about what Medicaid actually does? I wonder if he could even answer that question if it was put to him. Who it supports, who it helps, who it insures. And these stories are so important. It was Medicaid was the tip of the spear that stopped repeal right there. And it was these advocates that we have in the Senate and the House that brought that to the floor and talked about those consequences. It was the tip of the spear. But these stories that you're going to hear, they are really the tip of the spear for this issue. With that, I want to introduce Geneva Burrow Stone. She's an author and healthcare advocate from Maryland. Her husband is here, and they are here with their son, Robert. I don't want to tell her story. I want her to come tell you how important Medicaid and healthcare is to their family. Geneva?
Thank you. Hi, so I'm Geneva Stone from Maryland, and I'm a member of Little Lobbyists, a group of parents and families advocating for children with complex medical needs and disabilities. This is my son, Rob. Rob has recently graduated from Walt Whitman High School, and he has plans. He plans to be an artist, a writer, and a disability advocate. He enjoys baseball, movies, and museums, and he is a huge Game of Thrones fan. So we are unavailable on Sunday nights for the next couple of weeks. Rob also has a rare disease, and he's one of 35 million Americans for whom Medicaid has been a lifesaver. Before Rob qualified for a Medicaid waiver in 2012 in Maryland, our family had been through 6 different private insurers trying to avoid hitting annual and lifetime caps on coverage, and we had spent over $250,000 in out-of-pocket medical expenses. Unlike private insurance, Medicaid is designed for people with disabilities. It provides all 30 boxes of medical supplies that Robert receives every month. His specialty medications are covered. His therapies are covered. I don't have to fight with an insurance company to get Rob the customized wheelchair he needs, and it's a fine ride, but it retails for $8,000 to $10,000 without Medicaid coverage. Why does Rob need that wheelchair? So he can get out into his community just like his peers, go to Orioles games and the movies, and even have a beer now that he's old enough. Oh, sorry, he's so excited. He's getting a little overwrought. So Rob's Medicaid coverage provides home nursing, personal attendance, so he can live in his own neighborhood where everybody knows his name. Because of Medicaid, Rob can be with his family rather than in a nursing home where no 21-year-old young man should be. Rob's sister will be home from college next month, and he's looking forward to hanging out with her again. Before Medicaid, medical bankruptcy was a real possibility for my family. Nothing prepares you, nothing, for the staggering costs of raising a child with complex medical needs. Savings, family money, even selling your home cannot cover what is for my family now 2 decades worth of multiple specialists, tons of medical equipment, dozens of prescriptions, and too many hospitalizations and surgeries, as well as therapies, home modifications, and nursing. Survive and thrive. That's what Medicaid gave Rob, and that's what Little Lobbyists wants for all children with complex medical needs and disabilities. The chance to grow up to be healthy adults, like my son. Rob, now 21 years old, is living proof of the power of Medicaid. Thank you. And Rob has something he would like to say.
Okay.
Can you press this button now? Sorry, it takes a second.
Support Medicaid and Little Lobbyists.
Okay,
Thank
you,
you.
Rob.
Medicaid and Little Lobbyists.
Excellent job, Robert.
Thank you, Geneva. Thank you, Robert, and thank your entire family. With that, I want to introduce another person who is an advocate, who has been a fighter for this, who represents people who need help navigating the healthcare system. Matthew Cortland is a disabled, chronically ill lawyer and writer from Massachusetts, but he's also an advocate. And let me introduce him, and then we'll go, after he speaks, we'll go back to Senator Murphy. Matthew?
Thank you all for having me and for being here. I am alive because of Medicaid. I am one of the about 65 million plus Americans who have gotten necessary, vital medical care because of Medicaid. I'm still here with you because when my clinical team, made up of some of the best doctors in the world and world-leading experts in the inflammatory bowel disease I live with, said to me, actually, we can't discharge you from the ER. We need to admit you to the hospital. You're going to be here for a while, but we don't know how long. Medicaid covered that vital, necessary hospitalization. There was no prior authorization forms. There was no insurance bureaucracy to fight. I was in trouble. Medicaid was there. When they eventually discharged me and said, you can go home, but you can't eat anything for a while. You're going to get all of your nutrition through an IV every night. You're going to be hooked up to TPN, to an infusion pump for 8 hours. Even though it cost about $14,000 a week and I needed it for about 5 months, Medicaid was there. Medicaid paid for that vital and medically necessary service to keep me alive. And when it was finally time for surgery, Medicaid was there again. In 2014 and 2015, it cost about $720,000 to keep me alive, and Medicaid picked up that tab. This year, it looks like it's going to be a pretty good year. We're on pace for only $200,000, thanks to the outrageously expensive pharmaceutical products known as biologics that cost, $5,000, $10,000 a dose. I don't know what I would do without Medicaid. I don't know what I would do if the administration's lawsuit seeking to destroy the entire Affordable Care Act, and let's be clear, it is the entire Affordable Care Act at this point that they're seeking to have the court strike down. I don't know what I would do to survive that situation. I don't know.
What bell is ringing?
Good point.
What bell is ringing?
I don't know what I would do to survive that situation, and I have a number of advantages. I am a cis, het, white, male attorney at law who has literally organized my life around being able to get health care. I don't know what other patients, other multiply marginalized patients, are going to do should this lawsuit succeed, and chaos that almost inevitably will follow soon thereafter will come. And so I would just say today, as we're closing out Medicaid Awareness Month, I hope this is not the last Medicaid Awareness Month. I hope the administration, as fleeting as the chance is, does the right thing, changes their unprecedented position, withdraws the suit, allows the ACA to continue to be the law of the land in offering protections for pre-existing conditions and essential health benefits and prescription medications for me and patients like me. Thank you.
Thank you. Well done. Well done. Thank you to everyone for being here. The reason that the Medicaid expansion still exists is because of the little lobbyists and because of literally millions of families all across this country who rose up to come here to Washington, to call their senators and representatives and demand that in the end it was their interests that won out. But that victory achieved when we defeated the repeal of the Affordable Care Act is a fragile one, is at risk. And that's why we're here today. We'd be happy to answer any questions if anyone has them. All right, great. Thank you very much, everyone. Have a great day.